discuss a really important topic and a confusing topic for a lot of people, and that's pregnancy and acne. So what does a person do when they are pregnant and their acne seems to flare up? Before I start, I want to let you guys know that most of the times acne does tend to get worse in the first trimester or the first 3 months of pregnancy, but in a lot of people it also improves. So it's a person to person thing, but generally we do notice that acne does tend to get worse in the first trimester of pregnancy, and as the pregnancy progresses the acne flare-ups settle down. First of all, if you are pregnant and your acne is flaring up and it's a really bad case of acne flare-up, please visit your dermatologist, because they are going to advise you properly and guide you on how to actually treat your acne during pregnancy. I'm going to give you home management tips, plus I'm also going to give you a little bit of medical knowledge so that you go in aware and you yourself are quite careful when you are managing your acne at home during pregnancy. So what is safe and what is not safe? What is on the safe list and what is on the not safe list? I'm going to stick to cosmetics, because that is where the gray area is, and a lot of people are confused on what cosmetics to use during pregnancy and what not to use. And I'm going to also mention a few prescription drugs as well that are safe and not safe during pregnancy. Always there is a rule of thumb in medicine. The rule of thumb in medicine is that no drug, unless otherwise proven, is safe in pregnancy. So all drugs are kind of off the list. So if you have a medical condition for which you have to take a prescription medication, of course that your doctor will manage. Otherwise, no drug and no chemical is safe. Having said that, that is not always the case, and there are some things that are safe and that are not safe. So what are the safe treatments or the safe approach or the safe drugs and cosmetics that you can take when you are pregnant? What is the great fear and the great difficulty in managing acne during pregnancy? Unfortunately, all or most of the anti-acne medications are teratogenic. What is teratogenicity? Teratogenicity is when you ingest a drug or a compound that will actually result in a birth defect. It will harm the human embryo. So you do want to stay far away from all these things. And anti-acne agents and drugs are teratogenic, and on number one on the list is retinoids. So retinoids, retinols, the entire retinol family is completely out of question. And what's safe and what's not safe? I'm going to actually highlight the unsafe ingredients for you first. So oral and topical retinoids are completely out of the question. Oral isotretinoin, in fact, is just a teratogenic agent and is totally out of the question. Strong salicylic acid preparations, strong chemical peels are extremely not safe at all. Especially strong salicylic acid preparations are not safe. Then we would have antibiotics. So fluoroquinolones, tetracyclines, trimethoprim, these are all on the unsafe list. So how does this apply to cosmetics? Now, cosmetics pose another dilemma. Back in the day, we had just our basic few brands. We had Neutrogena, we had Rock, and just a few others. Now we have so many commercial brands, and they're very good brands as well, that contain retinol. So any retinol, all generation of retinols, retinaldehydes, retinol palmitate, any form of retinol is contraindicated topically. So when you go to Sephora or any online store that you are shopping from these days, then please, whenever you see retinol mentioned in any product, that has to be checked off. So no topical retinoids or retinols whatsoever in any form. Strong chemical peels, so strong salicylic acid preparations, strong chemical peels are again a no-no, because pregnancy changes the skin. We don't know how much of these chemicals, everything in life is a chemical, how many of these chemicals are being absorbed, what is the rate of absorption, how much are we absorbing into our bloodstream during pregnancy. So the safer option is don't go for anything strong. So strong salicylic acid, strong chemical peels, please strike that off. Any cosmetic brand that uses strong essential oils, anything unusual, just don't use it. The reason I say this is because so many of these ingredients have not been studied as far as their toxicity is concerned in pregnant patients. So just don't use essential oils. A lot of essential oils are not only irritating to the skin, but we don't know the potential toxicity of these essential oils. And some of them, like myrrh and frankincense, actually have been known when ingested in very large amounts to cause miscarriages. So since we don't know, and essential oils usually are in a very small percentage in your skincare products, but even then, to avoid an allergic reaction along with your acne, and that's really not going to be a good situation, just avoid essential oil containing products. So there we have it. That is the unsafe list. On the top are the oral retinoids, the topical retinols and retinoids, even in cosmetics, are complete no-no, and then the other things that I mentioned. Next, let's come to the safe list. So what is safe for you to use if you have an acne flare-up during pregnancy? And what is on the safe list? On the safe list, we have weak solutions of salicylic acid, benzoyl peroxide, azelaic acid, vitamin C, niacin, zinc. These are all safe topically. Topically, in milder formulations, all these compounds that I just mentioned, ingredients, are safe to use during pregnancy. If you have a really bad flare-up during pregnancy, then you have to visit, obviously, your dermatologist. And what they're going to do is actually give you just a few safe antibiotics. And the few safe ones are erythromycin and clindamycin topically. So a combination of erythromycin, clindamycin, along with benzoyl peroxide, a weak solution of benzoyl peroxide, salicylic acid, will really, really help you. They might also, in severe cases, give you a short course of cephalexin and erythromycin orally just in the first trimester, just for the first few weeks. And that's going to be a very short course, and that will also take care of the flare-up. And this is, of course, a prescription that you need to get from your dermatologist. What if you are super conservative and so you want to stay super safe? If you want to stay super safe, I would say that just avoid as much as you can. Stick to basic skincare. So cleansing with a mild cleanser, maybe just a mild physical resurfacer. So just mild exfoliation, physical, mild enzyme peels. Enzyme peels are another one that are quite safe. So if you want to be really on the safe side, avoid chemical peels, stick to enzyme peeling, physical exfoliation, enzyme peeling, and then a vitamin C and a zinc or a niacin combination. These are quite safe, and like I mentioned, salicylic acid, benzoyl peroxide, azelaic acid. So if you want to be really, really safe, you can do this. If you want to be even more careful, then I would suggest you look into light therapy. Light therapy, by light therapy, I mean blue light, laser acne treatment, flash lamp, or IPL. Look into these modalities. These modalities are, first of all, non-invasive. They're non-drug, and they will introduce no ingredients into your skin, no chemicals into your skin. So this is basically light therapy. You can opt for a combination of salicylic acid and a few things that I mentioned before, and combine it with light therapy if you have that option. So light therapy with mild topicals are really going to clear up your acne during pregnancy. So the takeaway message is that if you have an acne flare-up and you are pregnant, be very safe. Try to avoid all those things that I mentioned. And on the top of the list are all the retinol, retinoid family. Everything that must be avoided at all costs. So even if your favorite brand, there's a favorite retinol that you're using topically in a serum that you love, that should be just kept in the shelf and you should forget about it. So no topical and no, of course, oral, but no topical retinoids whatsoever. That is the #1 takeaway message.